Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gawain Vaughn.
Welcome to the Auburn Medical Group YouTube live stream with excitement. Apparently a straw. Wait, no, that's my straw.
I was going to say, get it out quickly before.
So I guess I should thank our supporters on Patreon because of our Dutch brothers.
Yeah.
So Dr. Mark, Dr. Gawain, and we have a guest because we're going to be talking about something having to do with PAs, physician assistants, sometimes referred to as physician associates. And let's introduce to all of you, here we go, with Nicole.
It's
and
me.
Apparently Lindsay's talking. Lindsay says she's present. Thank you, Lindsay.
Oh, thank you for being
Hi,
present.
Lindsay.
How do I take that off so we can talk to?
Nicole
There we
is
go.
present
Okay,
too.
I
Nicole,
am. I'm
we're coming back
here.
to you, Nicole. Okay,
I'm here.
this is Nicole.
Hello.
Nicole,
hello.
say Happy Mother's Day to your mom
Happy late Mother's Day, Bob.
because we know Mrs. Lee is watching, even though she should be working at the school.
Yes.
Ah.
Of course, she wouldn't miss this for the world.
Priorities.
Yes,
Come on.
yes.
We will be talking to both Nicole and Dr. Gawain, and the topic is specialty PAs. Many of you know about PAs, physician assistants. Of course, we talk to them, we interview them, we have some of ours talk. My daughter is a PA in Tennessee, and today we're going to be talking about a special type.
I see what you did there. I see what you did there.
Thanks. But first, real quickly, we're going to go to the comments, and we're going to come back to the subject because we have comments. We have this chat going that people who are watching us live can participate in. And of course, we always have Lindsay. Lindsay Antoine is present.
Yeah.
And Bianca is saying hi. Hi, Bianca from the UK.
Hello.
Laura Barzyk from the Midwest. And Bianca says, Happy Mother's Day was in March for us. Oh,
It's in the UK.
Oh,
okay.
I
noted.
think it was...
Is that like Boxing Day?
Boxing Day, yeah. The UK, they do everything on their own, but it was Mother's Day yesterday for us, and I think Canada, Australia, New Zealand.
World
the
traveler.
countries that matter.
Okay, so Nicole, introduce yourself to the nice people and your mom who
And
are
my
watching.
mother. I'm a PA student, go to school in Atlanta, Georgia, so I'm here in Auburn, California, which is where I'm from, staying with my family, rotating with Dr. Vaughn and the people here.
And you are, and it's been one week.
One
Yeah.
week.
It's been a good week.
Started last week.
Yeah.
She is seeing patients with us. Generally, we'll walk in and introduce her to the patients, and then kind of have her have run of the show. Actually, I've been butting in too much. Can't help myself. Sorry. We'll get to the point where I'm quieter, and then eventually, I'll introduce you, and then I'll step out, and you'll present the patient to me.
Beautiful.
But you're talking about being a specialist or going to a specialty. Tell
Right.
us a little bit about that.
I do. I want to practice in surgery or in a clinic with a surgeon, so taking a little bit of a load off of the surgeons. Big load. So basically the difference between NPs and PAs can be a first assistant in surgery. So with the surgeon, they get to help out, and then we'll do rounds on patients after surgery, make sure that they're healing well and feeling good.
And you're talking specifically about working with a general surgeon who does
Correct.
abdominal surgery.
Right.
So during abdominal surgery, when you're first assistant, where are your hands going to be?
So when you do, yes, present, sterile.
Yes.
Yes, sterile, absolutely. So, thank you. So surgeon stands on one side of the table, PA or first assistant stands on the other side. When you do abdominal surgery, most of it's laparoscopic. So you get 5 little incisions that are about this big on your abdomen. We stick really long tweezers basically into your abdomen and move some stuff around, cut some stuff up, and then take it out, and then you get those little incisions, 1 stitch in each of them.
Do you get to drive the camera?
I do get to drive the camera. Had to watch a YouTube video on it to learn how to do it.
Right. I remember
Yes.
this.
YouTube can be good for many,
Yes.
including for lay people to learn about medical topics.
Yes.
We found out. So how long have you been actually doing the surgical side of being a PA?
I did a 5.5 week rotation in surgery, general surgery. And then I also did a 5-week rotation in the ER, doing different types of procedures, sutures and incisions and stuff like that.
So that would still be considered surgical, although not necessarily inside of the abdomen. Or the
I would
abdominal
consider
cavity.
it surgical,
Okay,
yes.
Some of that is.
Yes.
And you've actually talked about wanting to work with specifically this surgeon that you worked with, correct?
Correct. Mhm.
Okay. And what all does he do besides just general surgery?
He does bariatric surgery.
Bariatric. Ooh,
Yeah,
tell us more.
bariatric.
Right.
Yes. So he does a lot of gastric sleeve, a lot of gastric bypass, which same thing, 4 small incisions. Gastric sleeve takes out 2/3 of the stomach, leaves behind a banana-shaped stomach that used to be the size of a football, and takes out a lot of the hunger hormones, so you don't get as hungry as often. Gastric bypass is usually better for people who have like diabetes or more chronic conditions, comorbidities. And that creates an egg-sized pouch where your stomach used to be and leaves the rest of the stomach in so you can still get all of the different acid, like the pancreatic juice and the what else is over there? Your gallbladder. Yes, the
Enzymes
digestive
to
enzymes.
digest, yes.
Yes.
You benefit from those.
Yes, you do. You kind
play
of
a
need those a
role.
little bit.
Yeah.
And then it'll connect to your small intestine.
Okay.
So, yeah.
Very good.
Yeah.
Now, Dr. Gawain, have you spent your time in the abdominal cavity?
Yeah, so as family practice, we do rotations through surgery as well. And as a family practice, you can assist in surgery too. Some actually can be trained. It's not as common anymore, but in some of the basic surgeries, I know some family practitioners who were able to do appendectomies, gallbladders, things like that. Not as common. I knew when I wanted to come out, I wanted to just stay in primary care outside of the office. But a lot of first assists, a lot of family practice doctors will essentially do the same thing that PAs do, where they, with their patients, their patient will be referred to a surgeon. The surgeon will do the surgery, but they'll be the ones who assist because it's their patient. So this happens a lot in smaller communities, more rural.
Do you think you'd want to do that?
I do enjoy doing that.
Like, you just take out a time in your schedule, or when the surgeon schedules your patient, say, hey, call me up.
Yeah.
It's my patient. I'd like to be there.
It's been a long time since I've been in the OR.
I bet they do
Then
that
you
with
can
this.
drive the camera.
Yeah, there you go.
Yeah.
I assisted in one.
Try to remember how to do
It's
sterile
opposite.
stuff.
Yeah.
It's been a long time since I put on those gowns, hated my card.
Yeah.
Have you done it since
Done the
they switched
360?
to just doing the hand sanitizer between cases?
No, it was still,
Yeah, the fulls.
yeah,
5
full,
minutes.
full
or
scrub
3
all the way up to
3
your
minutes, 5 minutes?
biceps.
5 minutes.
Yeah.
You guys do 5-minute scrubs.
We
man.
did
Getting
You stand in front of that sink a long time.
Yeah.
the nails.
everything.
Yeah, the nails, the
Yeah.
little brush thing. So I actually did assist since we've had this office.
Right, I remember that.
with an orthopedics procedure with Dr. Bergeson. That was fun.
Yeah.
It was actually it wasn't it wasn't a patient. It was a family member.
Hey, there you go.
But yeah, it was neat. I was able to scrub in. I hadn't done it in years, and
Right.
hold the retractor here. Things a first assistant does.
Yeah.
Don't
But-
move.
But that's what.
Yeah. Well, they
Yes, that's right.
Save
But that's
as
what
little as
Nicole
possible.
wants to do is
Yeah.
first assistant.
Yeah.
Yeah.
Yeah. And where would you want to do that?
I am hoping to go back to Atlanta for surgery.
Where you're doing your program.
Yes.
Okay. So Atlanta.
Yeah.
Oh my goodness. Do we have any viewers from Atlanta? Please do comment. So we're going to take a little break from our discussion to get caught up on our comments from our viewers. So the chat is going. We have
Yeah. If you have any questions
Yeah.
for a PA student or somebody wanting to go into surgery, please let us know.
So Bianca says, my son got his dissertation score thing today. He got 74%.
Score
He's
thing.
got his degree and he's coming home. So I'm excited. Congratulations,
Hey.
Bianca. That is good news.
Kids coming home.
Congratulations
Yes,
Dude, you're
yes.
at home.
on your
with your
son's
parents.
dissertation. And then Bianca also saying, do you want to do specific surgical specialty? I'll let you answer that right now.
Well, as of right now, I do want to do general surgery, and the surgeon that I specifically wanted to work with is a bariatric surgeon, so it would be a little bit of both.
Specialized.
Yeah, he does his call in general surgery. So 1 week on call.
All of general surgery there.
All of it, everything, abscesses, appendices,
Appendices?
appendices.
I guess it would be.
Yeah, I guess. But I also do like ortho surgery. So if general didn't work out, I would definitely do ortho as well.
Do you have to take call with the surgeon, or have the same schedule?
During school, I took call with the surgeon.
Okay.
And his first assist was not present, so I was his first assist for most of call, which was very fun.
Oh, nice. Oh, so you got to get your hands in there.
I did. Lots of hernias that week.
Good old
Lots of hernias.
Hernia week.
Good old
Followed by Shark Week.
Yes.
Yeah. Generally how it goes.
Yes.
Good.
Yeah.
Well, what's up in medical news or news of our office that we need to share with our viewers?
Last week, you had an ultrasound.
Yes, that's
How'd that go?
right.
Yeah.
Ultrasound. We actually had this. It was
Handheld.
I wish I could show it to you. It's about the size of a cell phone and actually
About that
transmitted
size,
by
yeah.
Bluetooth to a cell phone or an iPad, either one. And it was kind of fun. I was hoping for a different experience. We were really just, I'd go around the office, ask all the PAs and Dr. Gwen, hey, do you have something we can use the ultrasound on? And we had a few things. We had one interesting patient had something in their side that was a painful nodule, and it looked to be a cyst rather than a lipoma, we thought it was going to be. That was interesting. And we actually got a formal ultrasound. We'll see if they agree with our assessment on it. Another one, we tried to measure an aorta, but the patient didn't want to get a formal ultrasound.
Yeah.
I couldn't convince. It's something we do normally in men aged 65 to 75 who have ever smoked. We, at least 100 cigarettes in their lifetime, we check them for an aneurysm of their abdominal aorta, the large artery that goes through, delivers blood to the lower extremities. And I couldn't convince him to get a formal ultrasound. He let us do the ultrasound in the office, but measurements looked good. It looked like there wasn't an aneurysm. You were there, right?
Yeah.
And then today, everybody starts coming to me the day that we already sent it back. Everybody has something for ultrasound.
Yeah.
I think everybody came to me with, do you have your ultrasound?
Yeah.
And then we had to send somebody off for see if they have a deep venous thrombosis.
Which came back.
And was positive.
Man, that would have been cool to see.
That would have been one of our 25
That would have been cool.
qualifying for doing our own
Yeah.
ultrasounds to rule out DVT, or
Right.
deep venous thrombosis, blood clot in the vein in the leg. And that was disappointing that
Yeah.
we could have used all these things if we had it one more day.
Right.
Took it home, of course. My niece, we saw her baby. She's pregnant, so let her use the ultrasound to see her own baby, and that was fun. Tried to do some musculoskeletal shoulder stuff with Leanne,
Yeah.
finding landmarks and looking at tendons. So we may yet buy one of those ultrasounds. They're expensive. That's why you don't just go ahead and get one. And the reimbursement for primary care is kind of hard because you have to get a follow-up ultrasound for the first 25 at a minimum. That's if you have 100% correlation with their readings. And that's a lot to get for a device that says the battery will allow it to be recharged 500 times. Are we going to even pay for it with... And we may not have to pay off a piece of equipment like that if it improves patient experience.
Sure.
If the patients aren't going to have to go to the emergency department to get their ultrasound to rule out a DVT the same day because we can do it in the office.
Right.
There is value to that, although I really wish that our office was experiencing it rather than the insurance company. You know?
Right.
So we'll see. We may yet do it. So that's one thing that happened lately.
Yeah.
And then it seems like there was something else. No?
I don't know
No.
here.
No. I'm not thinking of anything specific. It just seems like in the news, they were talking about all the drug shortages.
Yeah.
Ozempic and human growth hormone for kids, who have pituitary problems. They don't have stimulation on hormones. Apparently the same company that makes Ozempic also makes
Didn't know that. I didn't see that one in the news.
Yeah, so stuff about that.
Yeah.
And the FDA does not require them to say why there's a shortage. I guess they're not legally required to tell the whole world their inside business, and so we don't always have an answer as to why. Is it because they're shifting resources somewhere else, or a factory shut down in another country, or they don't have the raw materials they need to make it, or we don't know. So going back to the comments here, we have, it's Bianca.
Yeah.
So let's see what Bianca says here. bring it on up on the, there it is. Bianca says, I fell on the bath and landed on my arm, just around my inner arm near my elbow. A lump is formed. I think it's a lipoma. Okay. Lipomas don't typically form from trauma, but something does. What we think this patient had actually, and that is a fat necrosis cyst, where the layer of fat between the skin and the muscle gets injured, and you end up with this little oily pocket.
I think I would think hematoma before I thought that. If you had, if you had a site of trauma,
he's smarter. both would be in the differential diagnosis. So.
It should be checked out by your primary care physician.
I've got.
Do not use this.
I got fat necrosis on the
YouTube
brain
video
now. That's right.
Necrosis on the brain. Do not let this replace the.
If you ultrasound
advice
my brain,
of your primary care doctor.
You would find
Right now.
fat necrosis.
Bianca says, my daughter had an MRI for an arachnoid cut?
Arachnoid cyst?
Yeah, maybe she meant to say cyst. She has in her head. It's been bothering her the last few weeks. See, that's a cyst also.
No.
And is a fluid-filled
structure?
Pocket.
Sure. Pocket or
cyst. That's what we fluid-filled thing.
Isn't that redundant? Fluid-filled cyst.
Yeah.
Thank you. I feel justified. Okay. And she says, I'm having one-person conversation with myself. Oh.
You're the only one commenting, but we appreciate it.
That's Bianca.
Sometimes.
Let us tell you how much we appreciate your participation. So you feel some sense of reward for filling up our message board there with your comments.
Yeah.
So thank you. We do appreciate you doing that. Anything else this week? Okay,
I showed
Nicole,
up
one
this
more
week.
thing before you go. First, make your mom proud, of course. We got to do that. You know what? I can't turn it.
What we should know is when I was in high school, I played basketball. And
That's what you need to
Nicole's dad was my coach.
That's right. Nicole is Coach Lee's daughter.
I am.
Here.
Yep.
Yeah. So
Yes.
tell everybody, and we'll let you do. You can do this because I can't turn it off. We don't have a delay, so you can actually tell the world what you think of our rotation here.
There's no,
Good or bad.
There's no
There's no
no
delay.
7-second delay.
No, it's not 7 seconds.
Don't cut
This is
though.
not a replay.
Just know that 4 weeks left on the rotation with us being the ones that decide how you do.
Isn't
But
it
go
not
ahead.
evaluation yet?
No pressure. No pressure.
No, it's been great. It's been a fun learning experience.
It could be. Could be an experiment. It's ongoing.
Yes, it's continuing. No, it's been good. I've learned a lot of things.
Already in a week.
I have.
Like what?
What's the coolest thing you've seen?
What is the
What
coolest
did we
thing
see?
I've seen?
Oh, you got to see a thing today. A dental abscess.
I did
didn't you?
get to see a dental
that?
abscess
Were you
today.
in there when I drained it?
Yes.
Tell what you saw.
A very
A river of.
Pus, I would imagine.
yeah,
I've seen
some
those.
super great smelling
missed
pus.
out on that.
Yeah. It drained
Could you
the
smell
whole-
it? I didn't smell it at all.
I could smell it. You couldn't smell it?
I did not smell it at all, and I was
Wasn't
right there
present.
in
It
his
was
mouth.
very cheesy.
Nice.
His mouth.
Very good.
Yes.
He talked about smelling it.
Yeah, I did
and
smell. But
I don't know why I couldn't.
I've drained a lot of abscesses recently. And it was very much
Abscesses
an
are
abscess
unpleasant.
smell. Yeah.
Okay.
Yeah.
So that was good today.
I did see that.
What
I,
else? Did you say she saw something cool?
I saw the biceps tendon rupture
Bicep
today.
tendon rupture. We did a knee injection.
We
last
did do
week.
a knee injection. We've done a lot of procedures. Took out some stitches.
Stitches.
Have you done any cryotherapy with
I did.
liquidation? Yes.
I did
Yeah.
cryotherapy.
All right.
Yeah.
So you have done a
Lots of
procedure.
procedures, which are my favorite part,
Okay.
obviously.
If
That's
you-
why I'm
yeah,
going
if
into
you're going to the
surgery.
surgical specialty.
And we hope to have you do more procedures
That's the plan.
I
by
hope
the end of
so.
the rotation. We like having our students learn to do procedures and to be able to do them.
Yeah.
Okay, good.
Yeah.
All right. Thank you for joining us, Nicole.
Of course.
We're glad to
Thank you
have
for having
here.
me.
Say hi to your mom one more time there.
All right. Hi, Mom. I'll see you in like an hour.
I'm on my way home.
I'm on my way home.
You live so close.
5 minutes down the road.
Do you walk home?
You could. You should
I
ride your
would,
bike.
but if
That's
you
what
saw
we
the
should do.
hills going to my house, it's uphill both ways, and I wouldn't make it in my dress shoes. Nope.
Okay. and you don't know this, but I actually grew up just like within 2 miles of where you grew up. So
Really?
yes, I know riding my. Are they still dirt roads?
No, it's
I
very,
rode my bike on gravel roads.
very badly paved, though.
Okay.
Yes.
All right. So until next time, this This is Nicole.
Yes.
Well, do you mind me saying your last name?
Oh, yeah, that's fine.
We said your dad was Coach Lee.
Yeah.
Dr. Mark Vaughn telling all of you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.